Advance-CTR faculty members, and I'm your host for the Advance-CTR's 2021 Qualitative Seminar Series. So we're here today and also for the next 2 Wednesdays to hear from 3 folks who use qualitative methods that are a little less well known than the interviews and focus groups and thematic analysis that, for instance, I teach and use. And today I'm incredibly excited that we're going to hear from Aaron Horowitz about design thinking. Aaron's the director of Sproutel, a local product innovation company. I love that they call themselves a social good factory. They use design and innovation processes to develop patient-focused products, which you're going to hear about. I'm also very excited that we're starting off the series by highlighting creative research methods in business. One of the things that I hope we're going to get to talk about is how and if these apply in the academic and medical research grant context that some of us work in. I'm going to turn it over to Aaron in a moment, but I want our attendees to know that in this webinar, we can't see or hear you. Aaron's going to speak for about 40 minutes, and then we'll have a chance to have him answer some of your questions, and you can ask those questions through the chat, and I'm going to get them to Aaron. At about 12 noon, those of you who are able to stay with us, we will be able to link you so that you can chat with us live. And we will stay together from 12 to 12:30 for folks who want to join in a face-to-face discussion about design thinking and qualitative methods. So with that, I'm going to turn things over to you, Aaron. Thank you for being with us.
Absolutely. And thank you so much, Rochelle, for the wonderful introduction. So formally, hello, everybody. My name is Aaron Horowitz, and I'm really excited to be here today and share a little bit about the work that we do at Sproutel and a little bit about design thinking, because this process is something that we use and is really the core of how we operate. So as Rochelle said, we kind of describe ourselves as a social good factory, and we create impact through partnership. So Sproutel partners with companies to research, design, and launch products that improve health outcomes. We've been around for 9 years, and we've created all sorts of different products. We got our start in kind of an area that we call play with purpose. The upper left-hand corner here is our first product, Jerry the Bear, which is an interactive companion for children living with type 1 diabetes. And then because of this work, we've gone on to create, in collaboration with Aflac, My Special Aflac Duck, a companion with cancer, and most recently launched in the upper right-hand corner, a very cute little critter called Purble, which is a research-based tool developed with the Committee for Children to help kids calm down. But I also just want to mention that while our work has had a big focus in creating cute and cuddly things, the design thinking process can really be used to create anything. And we have all sorts of other work that extends beyond the realm of cute, cuddly creatures. Most notably is this device in the lower left-hand corner, which we've been developing with Honda Research Institute, which is a video chat device for socially isolated seniors. So this kind of process is really focused on creating an extensible across a wide variety of user personas. We're a fairly small team. We're actually 10 folks now. We're based, most of us in Rhode Island, but also some folks in LA. And, just to start off with my passion for the work that we do, helping children with illness and helping people in difficult medical situations. This is me at my elementary school graduation. A little bit of a throwback. You can see that I'm quite a bit shorter than my peers. That's because as a child, I grew up with human growth hormone deficiency. So I gave myself an injection every day for about 5 years to grow. And I spent most of my childhood in doctor's offices, in and out of different endocrinologist offices. And through this experience, something that was really striking to me was feeling as if I wasn't a part of my own healthcare. I would remember kind of sitting in the doctor's office and hearing doctors, talk to my parents about me as if I wasn't there. And that's a feeling that I don't feel that any child should have, and more broadly, any person should have. So I've become really passionate about how can we leverage tools like design thinking to create products that bring people into their healthcare experience and that make people engaged in their healthcare. And kind of the secret sauce of our company is this design thinking process. We call it our kind of variant, a patient-centered, empathy-driven design process. So here is myself, my co-founder Hannah, doing some research for My Special Aflac Duck. And the real power of this process is listening. So, when we set out to design for people, what we really are doing is we're kind of designing with people. And at the heart of designing with people, it's all about listening. So we go out, we do these qualitative interviews, we listen to these end users, and our whole goal is to understand their problems and to develop empathy. And kind of starting with that core of empathy, our process kind of builds out. We immerse ourselves in the problem. We understand and visualize through all sorts of frameworks that I'm going to share to contextualize that particular user's problem. We ideate, we create all of these different solutions, and then ultimately we build, test, iterate, and go back to the end user. And when we think about design thinking, one of the things, my background is in engineering, and so I'll use kind of an engineering framework here. Design thinking is a recursive process, and that's something that's really fascinating to me. It's this process of diverging and converging. So you immerse yourselves with end users, you conduct these interviews, and you diverge. You learn all of this vast amount of information. And then we seek to understand it. And we use all sorts of different, qualitative research methods to visualize our learnings, to help us really wrap our arms around, what are the core insights that are, and the opportunities to solve the problems that this end user is addressing. And then we go back into another one of these kind of divergence and convergence loops. We ideate, we generate a whole wide array of solutions, and then we build them and we narrow down. We focus on testing ideas to narrow down to a solution that works. So today, I want to share a little bit about this process, which I just walked through, which is quite abstract. I want to bring it into something tangible and just sort of tell the story of how design thinking works within the context of Sproutel. So I'll share the story of designing My Special Aflac Duck, which is this companion for children with cancer. So just a little bit of background to kind of set the stage here. Our business, when we started working with Aflac to develop this product, we had to date had just launched and produced Jerry the Bear, and Aflac had seen that product and seen what it had done for children with type 1 diabetes, and came to us with an interesting question, which was, could we do something similar for children with cancer? And for those of you that don't know, and I didn't know when we started working with Aflac, they've had a 30-year philanthropic commitment to pediatric cancer. So they've donated about $135 million to the cause, and they were really looking at what they could do beyond philanthropy, what they can do to improve the lives of children who are undergoing chemotherapy treatments. And the really interesting thing there is that within the past 10 years, the survival rates for pediatric cancer have flipped. We went from a 20% survival rate to an 80% survival rate, which is incredible. And the thing that hasn't changed so much were the emotional support services to help children through that journey. And so that's where we really focused our efforts. And while we kind of had this directive of, hey, could we create, a similar type of companion for children with cancer as Jerry, we suspended disbelief. We actually sketched all sorts of ideas of what the end product could do on a Post-it note, and we shared some thoughts, but we asked for 3 months to embed ourselves in the hospital and actually figure out whether there was a there, so to speak, whether we felt that there was anything that we could create for children with cancer, particularly in this type of companion format. So we broadened our question, our how might we question, and this is often kind of a prompt that will kick off our research process or our inquiry. And so we didn't say, how might we design a robot for children with cancer? We just looked broadly, how might we improve the lives of children with cancer? So we always start out with some secondary research and then look to use kind of our direct interactions with patients to really understand more about their lived experience. So for us in this process, we heard these really, shocking statistics that the average length of treatment is 1,000 days, that kids see 80 doctors in their first day of diagnosis. And so as we immersed ourselves, we conducted all sorts of interviews with end patients and families. And so this is what it would look like. We'd go to the hospital each and every day that we were there, and we'd meet with about 12 patients. We'd have about an hour with each family. We'd interview the parents, and then we would interview the children to get both of their perspectives about their experience. And we also did a range of expert interviews during this time, talking to oncologists, clinical psychologists, child life professionals, palliative care specialists, music therapists, really every single person involved in the pediatric care team. And in this phase of our research, we were really looking for two things. The first thing was, and foremost, was to understand their experience. The second thing is that since this research was very narrowly focused on potentially creating a Jerry the Bear-like companion, we were also looking to see if some of the insights that had initially inspired Jerry the Bear were present in pediatric cancer. And really, what had inspired Jerry the Bear was observing children with type 1 diabetes injecting their stuffed animals and really engaging in imaginative medical play with their toys, ways that they were using play to act out everything that they didn't have control over. So we were also looking to see whether this type of behavior was also existing within children with cancer. So as we kind of came back from these interviews, we really sought to understand everything. And these are some of the visual frameworks that we use. So the first thing that we started to do is create these journey maps. And in preparing for this presentation, I picked through, we had all sorts of different diagnosis journey maps for different types of cancers, different treatment maps. But what this helped us contextualize were some of those statistics that we found so shocking. So this number of 80 medical professionals that you see in your first day of diagnosis, well, when we started to map that out, the head scratching actually started to diminish a little bit because we saw that most children, they initially went into their pediatrician's office with a cold or flu-like symptom, and eventually, after getting bounced from their pediatrician after some testing to a hospital, some of those children would have their Mediport installed and be receiving chemotherapy in the very same day. And so this really allowed us to step into the shoes of the patient and their families and understand just how overwhelming this experience was. Another tool that we use to help us do the same thing is what we call hear, see, feel, think maps. So as we synthesized our research, we created these hear, see, feel, think maps for children and their parents. And I'll just read kind of some of the anecdotes that were categorized in here, because it'll really give you a firsthand perspective of what these children are experiencing. They're hearing medical explanations, they're hearing child life explain things to them, they're hearing all sorts of words of support and encouragement. They're feeling love, they're feeling nervousness, anxiety, excitement, boredom, they're feeling overwhelmed and isolated. They're seeing their family members visiting, they're seeing all sorts of different treatment rooms out there, which is a really interesting quote, where kids were saying that the hospital felt like prison, and looking outside was looking at this, new world outside. And they're thinking, why me? I hate cancer. I don't want surprises. I'm bored. Am I done yet? Right. And so, tools like this, they really help us understand what is going on for those children. And they help us share it with our partners and share it with the members of our research team who aren't able to have those direct interactions with patients. Lastly, we pulled all of this information together into mind maps, where we started to chase out these quotes into the component feelings that these children were feeling. And what this will really become apparent later is how we used this technique in particular to develop a core feature of the duck, which was allowing children to communicate their feelings. So throughout this whole process, we kind of exited this understanding phase with key insights. And the first and foremost key insight that really led to most of the features in the duck was this loss of control. We saw that children lost so much control throughout their chemotherapy treatment journey that they gravitated towards play where they were in control. So the most requested toy in the Aflac Cancer Center were Legos, because for boys and girls, because kids could design their world. They had full control over it. And going back to kind of the initial research goals, I said sort of our primary goal was to understand their lived experience, and our secondary goal was to see whether or not these kids were engaging in similar types of imaginative medical play that we had observed for children with type 1 diabetes. And in fact, they were. It was a really common activity for kids to attach Mediports, which is the way that these children receive their own chemotherapy, to their stuffed animals. And Child Life, the individuals in the hospital who are responsible for ensuring that children have kind of a great pediatric experience, they had all sorts of toolkits that they were using to customize stuffed animals to look and feel, to look like the children, to have the same equipment that the children were using. So kind of using these key insights, we jumped off into ideation. And, our ideation is, this is actually a little time lapse we took that I'll just sort of narrate over. What we would do is we would create these how might we statements that appealed to different insights. So perhaps how might we give children back feelings of control, because that was one of our grounding insights. One of our other insights was that, for example, the day children were constantly interrupted and had a really hard time feeling as if they had personal space in the hospital. So another, brainstorming prompt for us was how might we give children, how might we allow children to reclaim their hospital room and to make it feel personal. So we would do all sorts of brainstorming, using these prompts. And the whole goal here is not necessarily having, the best idea. It's in going broad. It's in diverging. And, through this kind of broad exploration of ideas, we would then cluster ideas together and be able to slowly start to get towards different feature sets and groupings of features that we thought could be suitable for the duck. And once we had a few ideas here, we started to build and to test things. So these are some of our earliest prototypes of the duck. They're not pretty at all. But when we think about testing, we think about how we can begin testing as early as possible to validate these concepts. So one of my favorite prototypes that we built is actually this prototype in the center. It looks very, very nondescript. One of our ideas was that, calming children was something that was really important for us, because regardless of what type of cancer you have, feelings of calm is something that's very valuable for children throughout their pediatric experience. And, one of our ideas is that, hey, a cat's purr is something really common, but is it odd for a duck to purr? This is a bit of a silly question, but when you're designing, toys that provide comfort to children, these are the types of things we test. So that middle prototype actually has all of the electronics of a purring cat product that was readily available online. We bought it, we hacked it apart, we stuck it in a duck, and we took it to the hospital and we tested it with kids. And lo and behold, this is actually something that kids really, really liked. They loved having a feeling of something that reminded them of their favorite pet, and that gave them some haptic feedback that allowed them to focus and be mindful in stressful times. And so this is a feature that kind of ended up making it into the product. We also went and we created all sorts of wireframes because we had all sorts of ideas of a companion app that would go along with the duck and allow children to get a broader range of hands-on experience using medical tools. So I mean, here you see on the left a whole kind of wireframe for port access and port prep that we wanted to test with children to see if doing something like this was fun. And also if it might help relieve some anticipatory anxiety. And then ultimately we went into the hospital and we would go test these things with kids. So this kind of image is looking actually at one of our prototypes, this duck on the left, which actually just has a Bluetooth speaker inside of the duck. And what you can't see is that I am off screen with an iPhone playing sounds through the duck. So we used a Wizard of Oz prototype technique to prototype a lot of the interactions behind the duck, especially as we began working with, as our feature ideas began becoming more complex than what we could prototype easily. So we would Wizard of Oz these experiences to say, okay, is it worthwhile investing all of the technical effort to build out, this feature? Well, there's a really easy way to test that before we have to make that type of investment. So all told, this design process went for 12 months. We ended up working with 100 families and 35 doctors to develop the duck. And I think the easiest way to kind of just share and explain how it works is for me to, or to explain how the insights translated into the features is for me to just give a little bit of a demo of the duck. So I'm just going to stop sharing my screen and pop out here and introduce the duck to you and just walk through how all of this qualitative research, how our design process resulted in features that kind of directly meet the needs of the end patient. So everybody say hello to My Special Aflac Duck. Hi. So this is the duck. I touched one of its tickle spots under its wings. It's got sensors in its cheeks, down its back that respond to petting and that respond to touch. And going through kind of some of the key features, the first thing that became important was medical play. So kids can give their ducks chemotherapy when they receive chemotherapy. So this all goes back to giving kids that feeling of control. They can't have control over when they get their treatment, but they have control over when they give their duck treatment. And child life professionals love using this to go through a process where they give their duck chemo first, and then where kids get their chemo. The next thing that we learned is that it was really difficult for these children to communicate their feelings. And so we went and we created this series of feeling cards to tap on the duck's chest, and the duck will emote with the same expression as the card. So if you've ever wondered what a mad duck sounds like, or a sad duck, or perhaps a happy duck. And these cards have become really, really effective tools to allow medical professionals to communicate with children and not put them in the hot seat. So a lot of medical professionals have developed techniques where they ask children about how their duck is feeling about receiving chemotherapy, as ways of taking kind of the pressure off of children in answering those questions. And what we've learned is that the duck really becomes a proxy for the child's own emotions, and it becomes a proxy for how the child is feeling. One of the other features we created for the duck, this we call the soundscape spaceship. This was based on that insight that, you know, the hospital is a very noisy environment, and kids have a real trouble kind of reclaiming their own personal space within their room. So when you tap the soundscape spaceship to the duck's chest, the duck plays all sorts of different background environments. So here we're transported into a garden, and families love using this to fall asleep to. They use it for guided meditations. They use it simply to drown out some of the noise and beeping from machines. And then going back to our central insight of control, in the app, kids can control exactly what these soundscape planets sound like. So you blast off in the rocket ship into outer space, and they're able to dial up all of the different volume levels and design their own happy places. So kind of circling back to that insight of control, they get to control, you know, what their happy places sound like. They get to control how their duck feels, and they get to control how and when their duck receives medication. And I think just a really interesting insight from this process, or rather an interesting approach that we took to developing some of these features, really comes from this comm card. And I'll just share my screen again. So when we went into the hospital to start to develop this feature, we initially had done that mind map where we teased out all of the children's different emotions. But in order to kind of come up with a lexicon for kids to communicate those emotions, what we did is we printed out a rubric with all of the different feelings: happy, silly, scared, mad. And then we printed out all of the emojis in the iOS and Android emoji set. And this short video here shows the type of exercises we did with kids.
The bad guy.
This guy? Yeah.
What that is.
What do you think is mad?
I think this one.
This one?
This is the emoji I want to get.
This is your emoji? Okay.
Yeah, I'm gonna get the angry one.
The angry one.
So we would do these emoji sorts with kids, and they would match the emoji face to the word. And something really interesting happened with the word calm. We were doing research with kids who were between the ages of 3 and 11. And for those young kids, the 3 and 4-year-olds, calm is not a word that's necessarily in their vocabulary. And so we tried all sorts of different ways of kind of explaining this to kids. I remember turning to the person I was doing research with, and they said, well, it's like being in a bubble bath. And I said, well, it's like being wrapped in your favorite blanket. And every single child unanimously chose this emoji to describe that feeling of comfort, that feeling of calm. And this might seem rather benign, but to me, this really shows the power of the design process, the power of listening to patients. By doing this process where we've embedded ourselves with our end users, where we've listened to them relentlessly, we've been able to give children a way to communicate a feeling that they could have otherwise not put words to. And I think that's the real power of design thinking. That's the real power of why we do this, is to unlock that type of potential. So I actually just have a really short video here that just shows a little bit of the actual design process with children and what that looked like. So I'm just gonna pull that up now. And share my screen once more.
What if we could make a change in the lives of children with cancer right now?
I was told that, I'm sorry, your daughter has cancer, and I was just in total shock.
Everything's really new in the beginning, and they have no idea what to expect.
Each year, more than 15,000 kids are diagnosed with cancer in the US, and the average length of treatment is 1,000 days. And so we thought about the need for emotional comfort for these children. And now we have the opportunity to bring the latest in social robotics into the field of medicine, bringing comfort and joy through this daunting process.
Oh, that's awesome.
What we try to do here is to give children the tools to understand what's going on and to empower them.
For our family and for Wyatt, the best use would be to help him communicate and a friend to comfort him when he's having treatment.
Play is natural to a child. Play is really how they learn and how they process.
So we leveraged play and some of the latest technology to create healthcare tools for kids with illness. Everybody knows the Aflac Duck. We wanted to bring the Aflac Duck to life into a caring companion for children with cancer. It responds and moves in a lifelike and natural way. They could feed their ducks, bathe their ducks, and when you tap these different cards to the duck's chest, it behaves with that feeling to help children communicate their feelings. By the time the duck is shipping, we will have spent 18 months designing, testing, and iterating with hundreds of families, doctors, and experts.
Hi, Levi.
What do you think the duck is doing?
Singing.
Duck is singing.
Yes. Quack, 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 quack.
First and foremost, the duck is a constant companion for children throughout their treatment journey.
He's kind of cute.
He's kind of cute.
Candy's going to do some breathing, and we're going to kind of match her breathing.
Just a
Tiny bit faster.
Perhaps most important of all, the ducks can share in the patient's experience.
Actually, good job. Yeah, look at this. Pack is also getting one.
natural.
Yeah.
What?
I think it's so awesome. You just feel comfort, with something like that.
I really like the Aflac Duck to be your friend, to help you get through all your tough times here.
I think the duck has the potential to have a huge impact on our patients, our families, and our healthcare program as a whole.
So technically y'all want to make it happen to give everybody one or something?
That's the goal.
If she has something to sit with her, something that can take her through it. A friend that will always be there. And that would help a lot of kids.
So that video just kind of shows that all sorts of that design process in motion, and just shows kind of what it's like to go through this process of really collaboratively designing with the end user. So we launched My Special Aflac Duck in September of 2018, and we were thrilled by the reception of it. And then we've kept doing research on it. So we just published, or a few years ago rather, we published some research in pediatric blood and cancer that showed that this device, this toy for kids, but comforting companion perhaps, actually had some real impact. So we showed a preliminary effect on reducing distress for children and their parents, which for us really brought some great foundation to all of the stories that we were hearing from our end users. And to date, we've distributed 10,300 ducks at over 280 hospitals. These are absolutely free of charge for kids and their families. And that face, this is 3-year-old Tristan, who I met in Palmetto, South Carolina. The face of having a friend that's just like you, having a friend that can go through this experience with you. That's what motivates us. That's what makes us passionate about doing this kind of work. So I wanted to kind of just pull together some of our key takeaways of this process, of things that I thought might be valuable or helpful to those who are listening. And the first one is that patient needs are the North Star. So throughout this process, we were faced at multiple different crossroads with multi-stakeholder needs. So you can imagine we're designing with Aflac as a Fortune 500 company who has all sorts of needs, from the way that their brand is represented, all the way down to the way that they want the duck to be spoken about. We have stakeholders of doctors and oncologists that have kind of their own desires for what the most important thing is for the patient. But ultimately, we're responsible for meeting the needs of our end user, for meeting the needs of patients. And so at every step in the process, we would always prioritize patient needs. And I think a great, having Aflac as a partner in this was incredible, because they aligned around that. And just one example being their brand. So from the voice of the duck to the aesthetic of the duck, we tested all of those with kids, and we ended up using a duck voice that is far more sweet and subtle than the type of Aflac duck voice you hear in commercials. The duck never says the words Aflac. It speaks in a duckish language of coos and quacks, right? This was all something that was totally new, but it was exactly what patients wanted. Did patients want a duck with a very long, skinny neck, or did they want one with what we call kind of the cute ratio of 1/3 head to 2/3 body? Well, it's kind of no surprise that kids wanted the cute duck, and we tested each one of those things along the way to ensure that this was something designed for children who were undergoing cancer treatments. The next kind of key takeaway is that the design process doesn't stop. So, I mentioned that it's recursive, and not only in this divergence convergence, but also that it's continuous. So when we gave this duck out to families, this is one of our duck delivery events, which was these incredibly empowering experiences where we are able to provide kids with ducks and give them a little bit of background about how it works. We also kept doing our long form interviews with families after the duck shipped. So every year we talked to dozens and dozens of families to understand how they're using the duck, and to make sure that the ways in which we designed it are actually the ways in which it's creating impact. And in fact, through these interviews, in the end of 2019, we uncovered a really interesting opportunity. There was the opportunity actually a really interesting challenge. And the challenge is that many child life professionals who are our main champions at the hospital who distribute My Special Aflac Duck, they actually lacked the resources necessary to feel as if they were well-trained in using it with patients. And this was, in some ways, limiting the amount of ducks that were getting out into the hands of kids. So what did we do? Well, we went out and we interviewed 36 child life professionals, and we tried to understand the ways in which they were already using the duck. And we understood more about the challenges, but we also understood all of these, or learned all of these ways that child life professionals had invented different techniques that they had invented for mindfulness, for diaphragmatic breathing, that they had been using with children effectively. So we created a curricula. We call it the Child Life Specialist Care Kit. And it is this a toolkit of physical medical tools that allow them to demonstrate enhanced medical procedures, which was something that they asked for so that they didn't have to cannibalize and use equipment in the hospital that's meant for patients. We created a series of laminated, what we call facilitation cards. And this is 20 different techniques, each from a different child life specialist at a different hospital, that share a unique way of using the duck with patients, whether it's to help them calm down, whether it's to demonstrate a procedure. We created a detailed instruction manual that has all sorts of different ways to use the duck. We built in kind of some hidden features. Like, I'll give an example. When you tap that comm card to the duck's chest, the duck takes 5 deep breaths in through the nose and out through the mouth. Now, something that child life professionals didn't know is that we built in a secret feature so that when you tickle the duck, when you pet under its wing, it takes an additional 2 breaths. And that allows a child life professional to use the duck more like a puppet to be able to facilitate a guided breathing experience with kids. So we gave them kind of the full detail of exactly how to use the duck. And then we also created a guide that allows them to customize the duck. So ways that they can take a surgical mask and, with 2 cuts of a pair of scissors, transform it into a surgical mask for the duck, or ways that they can give the duck an amia reservoir, or give the duck an NG tube, really customizing the duck to be just like kids. And what wraps it all together is what you see on the left is a carrying case, which is kind of neat. It actually looks just like an MRI machine and a CT scan, which allows child life professionals to demonstrate what is, as they've told us, kind of one of the scariest procedures for kids, and one that they currently really lack in resources to be able to share. So we've been giving these out to child life professionals actually throughout the end of 2020, and have been hearing phenomenal feedback that this is really transforming the ways that they're able to use the duck with children. It's giving them this toolkit they can carry from room to room, and it's for some, bringing the duck into places that it wasn't previously. So this design process, it doesn't just terminate at that point where you build, test, iterate, and get a solution. It just keeps going to continuously refine what you've developed. And the last thing that I just want to call out is that design is interdisciplinary. I talk to a lot of people about design thinking, and often the first thing I hear is, well, I'm not a designer. And so, I'm not technically a designer either. I'm a trained engineer. The whole power of design is that through this interdisciplinary collaboration, on our team, we have designers, engineers, we have psychologists, we have people from public health backgrounds, right? From these unique and diverse perspectives, we all see slightly different sides of the problem, sides of the challenge. We all have slightly different approaches for how we might go about ideating and solving them. And there's an immense amount that is gained from forming interdisciplinary teams to go through this process. So I'm really honored that you all have had me to kind of share the experience. I'm so passionate about this process of design thinking and it being applied in places that it doesn't already occur, because really incredible things can happen when we all have more empathy, particularly